The U.S. health system faces many challenges. Healthcare costs remain high, disparities are persistent and worsening, and the burdens of chronic illness are straining families and communities. While each of us are motivated differently to do the hard work to achieve change, NNE PTN is leading the way to prioritize actions that pay for value, empower people, activate communities, and connect care. In the next few minutes, we would like to share with you how we are tackling these issues and achieving outstanding results. NNE PTN is a collaborative effort of trusted organizations in Maine, New Hampshire, and Vermont. The geographical area covers over 49,000 square miles. Enrolled sites are 93% small, rural, and 75% are specialty-type practices. We will explain more about what it means to be a benchmark site in upcoming slides, but you will note here by the yellow dots, these high-performing sites are widespread geographically, not an easy feat across rural northern New England. NNE PTN is tracking key enrollment and service delivery aims that define the high-value practices are expected to provide. With 9 months still to go, we have already far surpassed our 4-year commitments in engagement, outcomes, and savings.
One, in terms of clinical outcomes, is a project that we implemented to use the Columbia Suicide Severity Rating Scale, or the CSSRS, in our public school counseling program. So we trained about 85 counselors who are co-located in a public school to use this instrument that stratifies risk for kids that are expressing suicidal ideation or exhibiting suicidal behavior. By training these folks, we were able to hit about 1,300 kids.
Our average return rate for the standardized annual survey is about 6%. In our most recent test of the paper surveys, of the 400 clients seen across our office sites, we received an average return rate of 45.6%, with one office reaching a return rate of 67% of the clients seen. It is clear that the personal approach of asking clients to consider filling out a survey as a rate for their next appointment is a better method. With a high feedback rate, our clinicians are receiving immediate feedback on the quality of care they provide and are able to make adjustments accordingly.
Our success is measured quarterly with over 67,000 patients screened and working on improvement in 4 key clinical performance areas, including high blood pressure control, tobacco use, depression, and substance use. More than 12,000 hospitalizations have been avoided due to enhanced surveillance of adverse events, better coordination of care, and easier access to needed services in primary care and behavioral health sites. Utilization trends have identified 120 million saved from reduced hospitalizations and ED visits, and 1,600 patients avoided unnecessary radiation exposure from low back pain advanced imaging.
The NQF measure for hypertension was very useful because it gave us a baseline to know where we were going to start from to monitor our progress in our quality improvement program. It had definitely improved the quality of the care.
Up here in Washington County, our patients don't have the outpatient services that they do in urban areas, and anything that we can add to that, such as the chronic care management, I think would help the patient's health status as well as reduce readmissions to the hospital.
We started out with roughly around 6 patients, asking them how they're doing, going over medications, making sure that they were okay and if they needed anything. And now we are up to 96 patients that I call weekly.
It has reduced my potential for crises management.
Through the Northern New England Practice Transformation Network to work with clinicians across our state and across our region to address the opioid epidemic. We've done that in a variety of ways. First, working to spread education about addiction as a chronic illness, as a chronic brain disease, as one major strategy for helping to address stigma. We've also been able to work with our behavioral health organization, members of our PTN. Additionally, we've had some great opportunities to work at the community level through our Community Opioid Overdose Response, or CORE ECHO.
A high-performing health system is one of the highest ranking in at least one performance area across the 4 key aims. While we have identified 19 in total, 12 have success in only 1 aim, 4 cross 2 aims, and 3 are our highest performance in 3 of the 4 aims.
Oh, winter's coming. It's 30 miles to the doctor's. It's getting cold. She said, would you be willing to try self-testing? It's really very simple. It saves me an hour and a half. And then the doctor just determines how long you can go again before you have to have another test. It's really awesome.
I guess when I think about clinical microsystems, I think about working directly with frontline staff, the providers, the consumers and their families that are coming to us for services. And I think in using that model over the past couple of years, we've noticed that we've been able to improve and increase our access for consumers, reduce our wait list, and we're also showing significant improvement in reducing unnecessary ED visits.
The 19 health systems that meet our definition of high performance represent 142 practices employing 871 clinicians who, with their teams, are caring for more than 209,000 patients. By defining and surfacing exemplary performance, we have put a spotlight on new standards of care. Not only do these exemplary sites provide value, but they serve as benchmarks for others to emulate and learn from as we continue to raise the bar for performance. NNE PTN sites have incorporated many key aspects of the TCPI concepts into their ongoing operations. They will continue to deploy these ideas after the formal end of the initiative and thus develop and spread these efforts to others. The staff of NNE PTN want to thank our teams for their supporting engagement and CMS for their guidance and belief in us. We have shown together we can make a difference.